Weather is gorgeous, so I hope you're enjoying it and getting a chance to get outside. I just want to keep on going talking about migraine headaches. And so, why in the world would you even consider using cannabis if you are a chronic migraine person, or even if you just have migraines now and then? So, first, let's just review the phases of migraines. Not going to go into each one, but just kind of sum up what happens. So, you've got this dilation of vessels that places some pressure on the little nerve endings in the brain and in the skull that causes the throbbing pain and the sensation of pain. You also have constriction of vessels, and then there's also this releasing of all these inflammatory cells that all end up as a migraine headache. So, where in the world does cannabis fit into managing these symptoms? There are a couple of important journals that have actually, there's, I think, three journals that are doing studies, and some of these go back as far as 2007. The first one being Neuropsychopharmacology, number 6, dated 2007, where they reported that patients who suffered migraines actually have reduced levels of anandamide. Anandamide is one of our endocannabinoids. It's called the bliss molecule. And how they found this out was they did studies on patients by pulling off some of their cerebral spinal fluid, and then they checked the fluid for the levels of anandamide, and they found out that there was a decreased level of anandamide in those patients. The European Journal of Clinical Pharmacology, dated 2008, reported that endocannabinoid levels were decreased in patients with chronic migraines and in people who overuse their migraine medications. So they get the migraines, they aren't solved with their migraine medication, so they use more migraine medication, and so it just keeps going on and on. But the result of that was they are saying that there's a dysfunction of the endocannabinoid system, which is basically what the other journal was stating. And then in the Pharmacotherapy Journal 2016, it was found that out of 121 patients that were approved for a medical cannabis card, there was a decrease in frequency of monthly headaches from 10.4 to 4.6, with 39.7% of those people reporting positive effects of using cannabis, which helped decrease their chronic migraines. So, if you were to use cannabis for a migraine, what relief would you expect to experience? Well, all the things. It's relief of nausea, vomiting, you'll sleep better, and you'll also have pain relief due to the CB1 receptors in the brain that are activated when you use CBD or THC. Now, bear in mind, you don't have to use THC. You can just use CBD and have a positive result. But there is a consensus that says that you can use a higher amount of CBD, say 20 milligrams to 1 milligram of THC, and those two combined together are going to open up those receptors, resulting in a better outcome. So we're going to go the rest. What's today? Thursday. Tomorrow I'm going to talk about how would you use cannabis? It's kind of the same as everything else, but we'll go over it anyway. And if you've got questions, please don't hesitate to ask. It helps me know what kind of information you all are wanting to hear about. So that's that. Have a great day.